Okay, here is a microneedling question from Ask Dr. Rajani from our viewer.
Doctor, I love your videos. My question is, I purchased hyaluronic acid powder from BOS Essentials. If I follow good sterile practices and follow the instructions on the container, do you feel this is safe to use during microneedling, whether it be with a DermaRoller or the Dr. pen? Thank you.
Okay, wonderful question. This is a person who's doing DIY or at-home derma rolling or pen. I don't have a problem with that. I think the more you can do at home safely, the better. She purchased a powder, hyaluronic acid powder, that you mix with water and you place it on. I like things that you do at home that are fresh for your skin. Things like vitamin C, because they can be unstable. So you're meant to mix this hyaluronic acid powder with water and apply it to the skin. She's asking, it was a BOS Essentials, BOS is a company, can you use that powder, sterilely putting some water in there to microneedle? Great question. Now, depending on the water you put in, first of all, you have to have sterile water, and then I guess you take it out with a sterile needle, injection needle, or because syringes themselves are not sterile. But say take out the needle and you applied it to the skin, and then you did derma rolling or microneedling. That is the question. Here's the issue. I looked up that product. I looked up different ones as well, powders that are that you mix up on your own. They're not made for injection. They themselves are not sterile. And the problem is when you mix it, you have to get a sterile water because this will go into your body. There's derma rollers and there's pens. The rollers kind of roll over and they're fixed depths from 0.25 millimeter to typically 2.5 millimeters are the deeper ones. The pen you can typically adjust on the fly, 0.25 millimeters to 2.5. Now, everyone's skin is different. Some will have a thin dermis. Some people will have a thinner dermis, especially if estrogen is gone or they are thin-skinned, or the under eye is thin skin like the neck, whereas the cheek is thicker skin. So use different levels or depths all over the face, depending on who you are, your skin type, and how much you've done this before. Either way, it's entering the body. So you'll see blood when you go beyond 0.25 to 0.5 millimeters. That means you're getting this stuff in the body. The two main factors, it's not sterile. That's not good. It gets in your bloodstream. Not good. Now, you get away with it because the face is real vascular. We rarely see facial infections from natural products or surgical procedures. Knock on something, of course, because the face is very vascular. But you can get bloodborne infections and different things, unlikely here. But when we put something in the body that has a particle size, and if that particle size is above 60 microns and around 100 microns is typical for these, you can get what we call granuloma. And a granuloma is when the body starts attacking something that's of the right size that's not supposed to be there. And it's red, it's inflamed, it's enlarged, and sometimes we have to cut open and remove it. So for those reasons, I say no. Be very careful what you microneedle in. It's one of the biggest concerns I have. You can use products that are designed to do it. At my store at store.RajaniMD.com, I have a microneedling roller with growth factors that are meant to be used in a microneedling fashion. Maybe there's products that you like that you know, place in the comments, but it should be sterile, very clean, and the particle size needs to be known. I hope that helps. Ask more questions in the Ask Dr. Rajani below this video. There's a link. Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.